Good evening, everyone. This is Ali Karagosian, and tonight I'm going to be talking about the Masgutova Method, or MNRI, Masgutova Neurosensory Motor and Reflex Integration. I had the privilege of reading about this method this semester, and I am very interested in it, and I can see myself using it in future practice. So the next two slides I'm going to dedicate to explaining what the purpose of MNRI is, the background of it, and some of the basics. So basically, MNRI is designed to facilitate the emergence, maturation, and integration process of the primary reflex motor patterns for anyone, regardless of condition or age. It's a non-invasive, conservative approach that integrates one's reflexes in order to improve, restore, and optimize. So in order to break it down a little bit further, what is a reflex? So a reflex is a conscious or unconscious behavior or output that occurs when faced with a change or an input. There's a lot of subtleties in reflexes, and that's where the Masgutova method comes into play. So when breaking it down even further than that, reflexes come in learned and automatic reflexes. When I think of learned reflexes, I think of somatic musculoskeletal reflexes, such as the way that your body remembers how to ride a bike once gone through the repetitive motion of learning. And then an automatic reflex, I think of a reflex that you're born with that you just automatically do. Primitive reflexes are an underlying important factor of the Masgutova method and primary motor reflex patterns. Primitive reflexes are present at birth, and as one ages and reaches certain developmental milestones, these reflexes integrate with other reflexes because they can't function independently on their own. Someone who does not have the integration of those reflexes on their own may have an underlying neurological problem, and that's where the principles behind the Masgutova method come into play and can help these individuals. So why choose MNRI over other methods? Obviously, MNRI isn't the only intervention that focuses upon reflexes. However, it offers a very different perspective. It's a relatively new intervention. It's about 25 years old, and the perspective comes from all over the world. There is research and evidence from Russia, from Poland, and from the United States, integrated and used by clinicians in order to develop this method further. And contrary to what I believed before, when I first started learning about this method, I thought that it could only be used for younger people, for younger children and pediatrics, because I thought that primitive reflexes were only found in younger people. But I realized that through the aging process, as older adults age, primitive reflexes can come back. In addition, also that primitive reflexes can be present after a traumatic event occurs or when there's an underlying neurological problem. So principles from occupational therapy, physical therapy, speech-language pathology, social work, psychology, and audiology all can be applied to the Masgutova method's principles. And then there's 8,000 students, MNRI students, different clinicians from different disciplines being trained all over the world and that have graduated from the institute, meaning they have taken the classes in order to become certified and to put this into practice. So this is an overwhelmingly large number, but it is growing, and I think that it could be a very valuable place to practice, a very valuable. So for the development of MNRI, it was developed in 1989 with roots in Russia, which I'll explain a little bit later on the next slide. And then also it has some grounds in Poland, and it's constantly being developed through its practice and has come over to the United States of America. It was founded by Svetlana Masgutova, who is a psychologist in Russia in 19. And Svetlana Masgutova, her research began from the Ufa explosion in Ufa, Russia, which has been known as a pivotal event in this intervention. In 1989, a train explosion occurred and 500 people were killed as two trains were destroyed in a pipeline explosion. Dr. Masgutova worked with children who had survived this train crash and experienced PTSD, post-traumatic stress. And she realized that more than cognitive therapy was needed, and that in these children, primitive reflexes came back. So when she used her techniques, she helped them to reconnect with the world and to integrate these primitive reflexes again, so that instead of just merely trying to survive, they began to thrive again. And this became a catalyst for her technology and cost. There is very minimal technology needed for the Masgutova method. The two factors that I have listed below are technology that's been used in research, but when actually implementing this method, it's physical movement. It's movement that's implemented by a clinician in a treatment setting. So it was hard to pin down a specific cost, but there is a cost associated with becoming an MNRI certified clinician. And that cost is also very variable depending on what discipline that the clinician. So for funding sources, this is not a practice that is used hugely throughout the world, but it is getting more popular and can be billed in some places under therapeutic exercise as a therapeutic activity. And then in order for a clinician to become certified in MNRI, as I was discussing on the previous slide, they likely have to pay for it themselves. Sometimes places of employment may pay for it, and then also grants can be given in order for people to become trained. Below, you can read the treatment guidelines for intervention. I put 5 different bullet points as to the process of the Masgutova method. It begins with reflex dysfunction. The clinician will begin by trying to find out where the breakdown is, and then it works all the way to using tactile, visual, auditory, and proprioceptive function, integrating the senses and thus the reflexes in order to improve and possibly make a complete recovery of general. So for diagnostic groups, as I had discussed before, MNRI is appropriate for all age groups. That's contrary to what I believed before. Much of the literature, when you first start out looking, focuses primarily on pediatrics, but it is in adults and older adults as well. So specific diagnoses, as you can see below, are very variable. Autism, dyslexia, cerebral palsy, ADHD, genetic disorders, dementia, and Parkinson's disease, to name a few. So then I began to look at the evidence-based practice, and a lot of the notable research comes from Dr. Masgutova herself. It began in 1996, the research that was listed through movement development and personality growth, and went on to 1998 to 2002, focusing more on the physical aspect and postural reflexes and whole body movements. In 2002 is when they began developing the handbooks, and in 2008, visual reflexes came into play, and in 2009, EEG under MNRI program exercises with brain waves were studied. So there were 2 articles that I found and looked through that were not written by Dr. Masgutova herself, and the first one was by Pilecki et al. And this article, or this study, utilized brainstem auditory evoked potentials, or BAEPs, performed for children who had cerebral palsy to test the efficacy of MNRI. And the study found that the results yielded were advantageous and showed that the method was effective in helping with the recovery. And then the next article I found was by Rentschler, 2008, The Method of Neurosensory Motor and Reflex Integration, Key to Health Development and Learning, discussed the 2 purposes behind reflexes, protection and development, and this article really helped break it down for me. The protection and development part helped me understand the primitive reflexes and how when someone's been through a trauma, they're trying to survive. That's where the protection comes into play instead of thrive, where the development part comes into play. And so the author provides very great detail in this article about how MNRI can integrate the reflexes in order to promote several different things, such as healthy protection and survival reactions, healthy self-regulation, gross and fine motor skill development, transition from reflex patterns to intentional movement and motor skills, refinement of controlled, skillful, intentional movement, enhanced memory, attention, focus, and perseverance, motivation and confidence, maturation of social skills, and mature cognitive. So getting into the personal aspect, I'm interested in focusing on neurological studies in my career as an occupational therapist, and I see this as a very important and exciting up-and-coming practice. Thank you for watching my show, and I will see everyone here at graduation.